Hello, my name is Manish Rungta. I'm a physician associate at Bay Area Gastroenterology, and today I'd like to talk to you about one of the common ailments that patients face, constipation. Constipation is a condition in which a person has fewer than 3 bowel movements a week, or has bowel movements with stools that are hard, dry, and small, making them painful or difficult to pass. People may feel bloated or have abdominal pain with their symptoms. Some people think they are constipated if they do not have a bowel movement every day. That's incorrect, however. Bowel movements may occur 3 times a day or even 3 times a week. Most people get constipated at some point in their life. Constipation can be acute, which means sudden and lasting a short time, or chronic, which means lasting a long time, even years. Most constipation is acute and not dangerous. Understanding the causes, prevention, and treatment of constipation can help many people take steps to find relief. Constipation is one of the most common GI problems in the United States, affecting an estimated 42 million people, or 15% of the population. People of any age, race, or gender can get constipated. Those reporting constipation most often are women and adults age 65 and older. Constipation is also a common problem during pregnancy and after childbirth. Those patients who have surgery or patients who take medications to relieve pain can also experience constipation. Constipation is caused by stool spending too much time in the colon. The colon absorbs too much water from the stool, making it hard and dry. Hard, dry stool is more difficult for the muscles of the rectum to push out of the body. Common factors or disorders that lead to constipation are diets low in fiber, lack of physical activity, medications, life changes, or daily routine changes. Ignoring the urge to have a bowel movement can also contribute to constipation. The most common cause of constipation is a diet with too little fiber. Fiber is a substance in foods that come from plants. Fiber helps stool stay soft so it moves smoothly throughout the colon. Liquids such as water and juice help fiber to be more effective. Most patients don't achieve enough fiber in their diet as the cause of their constipation. A lack of physical activity can also lead to constipation, although we do not understand why. Lack of physical activity is thought to be one of the reasons constipation is common in older adults. Medications that can cause constipation include pain medicines, especially narcotics, antacids that contain aluminum and calcium channel blockers, which are used to treat high blood pressure and heart disease, medications that treat Parkinson's disease, antispasmodic medicines that help to relax the colon, antidepressants, iron supplements, diuretic medications, anticonvulsants, and overuse of the over-the-counter laxatives. Functional gastrointestinal disorders are problems caused by changes in how the GI tract works and also contributes to constipation. Irritable bowel syndrome is one such example. It is a functional gastrointestinal disorder with symptoms that include abdominal pain or discomfort, often reported as cramping, along with constipation and diarrhea, or both. To diagnose the cause of constipation, a healthcare provider will take a thorough medical history, perform a physical examination, and order specific tests. The tests ordered depend on how long the person has been constipated, how severe the constipation is, the person's age, and whether the person has blood in stools, recent changes in bowel habits, or weight loss. Most people with constipation do not need extensive testing and can be treated with changes in diet and exercise. However, those who are 50 and over, or those who have blood in the stool, or a recent change in their bowel habits should undergo colonoscopy so as to rule out colon cancer. Colon cancer is the 3rd most common cancer in this country and should be excluded in patients who have a new onset of symptoms of constipation. There are other studies that can study constipation as well. Colorectal transit studies can be performed. Use of radiopaque markers, scintigraphy, anal rectal function tests, anal manometry, balloon expulsion tests, and defecography are certain examples of tests that can be used. Treatment for constipation depends on the cause, severity, and duration of the constipation and may include one or more of the following: changes in eating, more healthy eating, diet, and nutrition, including 20 to 35 grams of fiber daily with liberal amounts of water, need to be instituted. Exercise and lifestyle changes with more physical activity are also crucial. Medications such as stool softeners, laxatives, suppositories, enemas are also used. 2 of the newer medications for constipation are in the category of chloride channel activators. These include lubiprostone, which is Amitiza, and linaclotide, which is Linzess. And these medications are very effective in treating constipation. Surgery to correct anal rectal blockage caused by rectal prolapse is also an option in these patients. Surgical removal of the colon may be an option for people whose muscles of the colon do not work properly, causing severe symptoms that do not respond to medical treatment. Biofeedback is another technique used by doctors to help patients with constipation. Biofeedback uses special sensors to measure bodily functions. The healthcare provider uses the information to help the person modify or change abnormal function. There are some complications of constipation that can occur. Hemorrhoids, anal fissures, which are tiny tears in the anal rectal canal, can occur. Rectal prolapse and fecal impaction, where stool is stuck or impacted in the rectum, can also occur. Fecal impaction is a very debilitating condition, more common in elderly patients, and requires manual disimpaction with the digits to help remove the stool. So getting ahead of this with appropriate medical management prior to impaction is crucial. So in summary, constipation is a chronic debilitating problem for many patients. With aggressive bowel regimen, healthy diet, more fiber in the diet, exercise, and various medicines, constipation can be managed well. We at Bay Area Gastroenterology will be happy to see patients in regard to constipation and do colonoscopies on those patients that need them.